So when we're treating the SI joint is heavily influenced by, obviously, the lumbar spine, the sacrum, and the pelvis, the innominate itself. One dysfunction that oftentimes happens is what's called an upslip, which is where the innominate is actually kind of jammed up. A whole host of different things can cause that to happen, but anytime we're trying to treat the SI joint, if that's something that hasn't been looked at, something that hasn't been addressed, it makes all the other corrections much more challenging. So what I want to show you is what's called the clavicular jump test, which is a test that we do to screen out for an upslip. And then I want to show you just kind of the cascade of events that can happen from that. So with this test, we know that when our patient raises their arm up, their clavicle should inferiorly glide, right? At the SC joint, the clavicle should inferiorly glide. This test is considered positive if it goes up, okay? So negative would be going down. Negative would also be just staying stuck there. For the test to be considered positive, it must go up, okay? I'm just going to place my hands on the proximal end of the clavicle, but I want to make sure I stay off of all the muscles that attach onto the SC joint there. So go ahead and raise your left arm up. My patient raises his arm up. I'm feeling to see if it goes up, and it does not. So his left side is negative. I'll do the same thing on the right side. And his right side goes up. Okay. Sometimes it's very subtle at the end. Sometimes it's more significant throughout the motion. There's a lot of variability, but what we're looking for is for it to go up. So he's positive on the right side. What's interesting with this test is that oftentimes an upslip on this side will have a great effect on how the muscles at the hip are able to contract or not contract. And so it's very common when you have an upslip on the same side to have weakness or inhibition to glute med, the hip abductors on that same side. So just for demonstration purposes, I'm going to go ahead and manual muscle test that side to see if in fact that's going on. So when we did our clavicular jump test, we found that he was negative on his left side. So just for comparison's sake, I'm going to go ahead and manual muscle test glute med on this side. It should be nice and strong. I should not be able to budge his leg, right? And in fact, that's the case. So when we did our clavicular jump test, our patient was positive on the right side. So now I'm going to manual muscle test glute med on this side just to see if there's inhibition going on there. So again, he's going to hold his leg up here. I should not be able to budge his leg down at all. And he's given great effort. In fact, I'm going to give him another shot here. We'll see if he can do it this time. Okay, I should not be able to win that, just like you saw on the other side. So now I'm going to go ahead and correct that. So to correct this, I'm going to come down to the very bottom part of his leg here. I want to make sure I'm not grabbing on the talocrural joint. I want to grab above his ankle, and I really want to get onto skin here. I don't want to be on top of his socks or on top of his pants, because as my hands are going to slide here. I want to have a nice good purchase on his skin, okay? I'm going to slightly abduct the leg here, and then I'm going to fully internally rotate here. They may not have a whole lot of motion there, but I'm going to take whatever they've got, because I want to lock in the hip here. I don't want to mobilize the hip. I want to go right to the sacrum, right to the SI joint here, okay? I'm going to just simply take up some slack here. I'm not taking him up to end range, just taking him up some slack, and then just a quick little short grade 5 pull. That's all, okay? I can do it a couple more times if I want. Any pain with that? No. Yeah. And I'll do it one more time just for good measure. Okay. And then I'm going to retest. So after doing our correction now, we want to retest to make sure that we got the correction we were looking for. So the SC joint, proximal end of the clavicle, should glide down. What happened during the first test was that it went up. That was positive for the clavicular jump test. So now I'm going to retest and see if it in fact goes down, or at least doesn't go up. Go ahead and raise your right arm up again. Okay. And that time I did not feel it glide up. Go ahead and do it again. Good. That time, a little bit of inferior glide there, okay? So now the test is negative. So now I'm going to go ahead and retest glute med on that same side and see what functional change we got out of the muscle. So now we just corrected the upslip on the right side here, so I'm going to retest it just again to see what functional change was made. Before, he was inhibited on this side, and really the reason that he was inhibited there, which I didn't explain before, was because most likely quadratus laborum, which originates on the lumbar spine and attaches onto the innominate here. Oftentimes with an upslip, quadratus laborum goes into a shortened position here and becomes hyperfacilitated, kind of hyperactive. And that hypertonicity oftentimes will cause an inhibition to glute med. That's the reason that you see the weakness with glute med testing on the positive side. So we just corrected the upslip, so now I'm going to see if that relationship is now restored. I'm going to roll you forward just a little bit. So go ahead and hold your leg up towards the ceiling. Again, don't let me push you down. And good. I'm putting all my weight into him and I cannot budge him. That's normal.